So, good morning, everyone. And first and foremost, thank you to all the essential employees out there doing what you're doing. As always, we're always thinking about you, so thank you. Unfortunately, sadly again, we have 3 more Albany County residents passed away overnight. A man in his 70s and 2 women, one in her 70s and one in her 80s. All had underlying health conditions. This brings us up to 56. So my condolences and prayers go out to the families, as always, to the new 3 families and to the other 53 families yesterday. Again, I want to remind everyone, as I did the last couple of days, that these are difficult times. And it's more difficult for people with loved ones that are home that can't say their goodbyes in the right way and have to do it via FaceTime or Skype or Zoom, whatever it may be, if they are fortunate enough to do that. But again, my condolences to the 3 families. One of the other things that I like to highlight is the letter I sent, not just as county executive, but as president of County Executives of America and as a president of NISAC for the county executive side of the House, to Congress, to the delegation, to really say, you know, the last stimulus package came out. We do need money. Albany County and counties around, not just the state of New York, around this nation, are on the front line. We're the ones that are out there doing the work through our health departments and, you know, mapping and tracing, but also providing vital services to the community, to like mental health and other areas that I could go into. And we're obviously spending a lot of money to fight this. And it also being shut down costs the county a lot of tax revenue. And I always take pride, we're like the 6th lowest taxes in the state of New York. Which says a lot for a county our size of almost 320,000 residents. But we do a lot to depend on sales tax. And I've pointed out in the beginning that we're probably $30 million off. A lot of our programs are unfunded mandates from the state government, not from us, from the Senate and Assembly, and from the governor's office that push down to the counties and tells us we have to run these programs and we have to pay for them. And we pay for them through sales tax revenue and without raising taxes, property taxes. And in these difficult times, the last thing I want to do is raise taxes on homeowners because you need to be relieved. You need to have that burden off you as we reopen and we try to reimagine, like I said a couple days ago, of what everything's going to look like, the workforce, the outside world to everybody, restaurants, movie theaters, concerts. You know, that's why I kept saying we have to reimagine what we're going to look at. So I do want to especially thank Congressman Paul Tonko and everyone else that we've been dealing with, but that's going to have a huge hit from the car dealerships, the gasoline. You could go on and on and on. If you look at Crossgates, Colony Center, they're closed. Pyramid Mall a couple weeks ago filed for bankruptcy. So these are things that are going to be the new norm, and you're going to see a lot of restaurants doing the same thing. That's why I said our backbone of our communities, our small business, we need to support them, and we need to help them reopen in this new environment and support them more now than ever. Because like I said before, that's the first exposure anybody gets for a job usually, if you have children, or when you're growing up at one point in time in your life that you had the opportunity to work at some corner store or you worked at some store down the street, and you know, it gave you an idea of what you want to do in life. So we have to make sure that we keep the small businesses going and be part of the solution, not part of the problem as government. And again, you know, we're looking amounts of about probably $2 billion in losses around the nation, and probably like $144 billion impact on the economy on a national level. I've talked to a lot of county executives from across this country. I've talked to different governors and different people, and I got to tell you, we're all in this together, and we're all trying to figure it out, and we can do this together. So as of today, we have 1,277 positive cases. That's up 25 from yesterday. We have 1,041 people under mandatory quarantine. That's up 52 from yesterday. And we have 5 people under precautionary quarantine. That's down 3. Our Shaker Place nursing home, we have 50 residents now who have tested positive, including 2 who have recovered. 18 employees now we have tested positive and remain out of work, while 9 others have fully recovered and returned to work. We have 2,894 people that have completed quarantine, And some really good news, we have 753 tested positive for the virus and have recovered. That's up 89 from yesterday, which is good. We have 28 people in the hospital with a hospitalization rate of 2.19, and we have 7 people that are currently in the ICU, and that's down 1 from yesterday. So again, I want to remind everybody, we've been aggressive with testing. It's something that Dr. Whalen and I and my team want to make sure that we've done for this, for the not just Albany County, but for the capital region. Mobile testing site number, as always, 518-465-4771. And the Rite Aid, obviously, you got to go online, riteaid.com, and the urgent care. And so far, with all of them sites going on, we've tested an extra 1,435 people, which is also good news. And some things have changed. The criminal justice system really has changed with all the stuff they passed last year, but has really changed in what's going on with this epidemic and being shut down pretty much for the last 8 weeks, and court systems being done differently. So arraignments are done differently. Everything's virtual pretty much right now. You're seeing things handled differently. So, you know, these are things we're seeing less of: drug charges, vehicle and traffic offenses, obviously, because everyone should be staying home, quarantining. And, you know, so I brought in our Albany County alternate public defender, Tina Sodi, to talk about the public defenders, what they've been doing in the arraignments and arrest, and let her talk a little bit about that aspect of how the criminal justice system has really changed in the course of these last 8 weeks. Tina?
Thank you, Dan. So I believe a lot of people probably don't realize that the courts are still open. They are, designated courts have been assigned in Albany County to remain open, specifically county court. So county court has been the designated hub for most of the arraignments that occur. So we have a system set up. Everything is done virtually. Now some of the local courts are doing arraignments virtually as well via Skype. Not all of them are set up, but they have been designated courts. The bigger ones are set up. So generally 9 to 5, which is considered normal business hours. Anybody that gets arrested, the case is handled in county court. So nobody's physically going to court. There is a skeleton crew that is physically in court with respect to the court staff, the clerks who handle the paperwork. But an individual that gets arrested would be held at Albany County Jail. And Sheriff Apple graciously has agreed to set up an area there where Skype could be conducted from the jail. So our clients are at the jail. Their attorneys either are in the office or they are at home. The judges are at their homes. All are and the prosecutors are at home. So everyone gets on Skype to conduct an arraignment. It goes on as it would if we were physically in court. Obviously, it's a little different, not standing next to our client, and so that makes things a little difficult for us. However, it's being done. So it is, with respect to Dan saying that crime has gone down, yes, certain crimes have gone down, such as petty larcenies, because our malls are closed. So the theft obviously has gone down. Drug charges have gone down merely because not too many vehicle and traffic offenses are occurring, or the police aren't conducting too many traffic stops. So drug charges have gone down. There hasn't been a lot of drug sales merely because the grand jury is shut down. There is no grand jury proceeding currently, so no sealed indictments are occurring. So those crimes have gone down. We are getting still a decent amount of felonies that are occurring on a regular basis. Weapon charges are still there, burglaries are still there, few robberies, domestic incidences are still there. As we know, these are hard times. Emotions are high, so we are all stuck home with our families. As much as we love them, they do get on our nerves. And sometimes when emotions are high, we end up saying stuff or doing something that shouldn't happen, and then the police gets called. And when there's a domestic incident, there's a concern with respect to orders of protection. So arraignments do happen 24/7. Attorneys are on call 24/7 from the public defender's office and few from my own office. And therefore, if somebody gets arrested, we do get notified immediately by the courts or law enforcement or the judges to let us know that somebody was arrested. We get an opportunity to speak to our client. Either we call them at the jail and speak to them, or if they're at the local police department, we call the local police department and speak to them there prior to going forward with their arraignment. So it is a different process as far as what the courts are doing and how long they're going to do this for. We honestly don't know. We get a new directive on a weekly basis based on what the governor is trying to do and what the chief judge tells us to do. As to if we're going to be able to open, nobody really knows. And as we all know how the court systems are set up, it has a lot of people in a courtroom on a regular basis, the amount of prosecutors, defense attorneys, clients, families, law enforcement, to make arrangements to keep the social distance and still go forward with the proceedings is difficult. So I anticipate that we will be doing virtual proceedings for quite some time, and whether as to how much we do, it's going to be up to the chief judge and the governor as to how many proceedings or what kind of proceedings and hearings can go forward. I don't anticipate us doing trials, obviously, virtually, but I do anticipate at some point we are going to start handling more matters as we would in a regular courtroom, but just via Skype.
Thank you, Tina. And, Sheriff Apple's been a huge advocate of this for years, doing things, arraignments this way, because it saves on transportation, bringing prisoners out of the jail down to the courthouse, back and forth. It saves money, and it makes sense. So hopefully when you look at reimagining things, this is something that will benefit the taxpayers going forward, so which is good. But Liza, as always, please.
Thank you, Dan. So, there's a lot of discussion that's going on in terms of reopening, and of course, there is a tremendous amount of economic considerations that are concerning many people. And from a public health perspective, we certainly understand that. But it's very necessary going forward that we realize that the public health risk has not been mitigated completely, nor will it be mitigated completely until we have either a large percentage of the population that's immune or a vaccine for this virus. So the challenge for us going forward is how we can discuss a phased reopening and what reopening looks like in terms of utilization of mitigation strategies. This morning, we had a call among the Capital Region health departments that are going to be working together on this strategy for reopening. And, there's a lot to discuss. The concept of a new normal is very nebulous to most people. Personally, I'm not crazy about the new normal because it's not normal. Nothing about this is normal. And it's something that we have to realize on a daily basis. So as we go into the next phase of reopening, it's important that public health informs ways to mitigate risk. We talked a little bit about this in the past few days, about how, the considerations around who can work from home will probably continue. The considerations around strategies that include social distancing in the workplace and in places of business are going to be important. The continued importance of the strategy of masks in public will be part of the recommendations coming forward as we phase out slow reentry. And of course, as has been discussed, this is not a switch that we will flip. It is not a switch that we will flip to go back to any semblance of what we would have considered normal, but it'll be a dial. And how do we look at that dial, and how do we inform that dial? Because of course, it's going to involve very careful monitoring on a daily basis with the ability to scale back. Because we know the vast majority of the population, and this of course includes residents in the Capital Region, of which a very low percentage demonstrated antibodies when the antibody testing was done, on the order of 2.4%. 2.2%. 2.2% we're determined to have immunity, we're determined to have antibodies, and we don't necessarily know yet what that means in terms of immunity. So the vast majority of us are still susceptible, and the vast majority of all of us have to act as if we are susceptible and inform that concern into our daily lives. So we will continue to have these discussions. We work closely with the New York State Association of County Health Officials as well as the state health department to help inform the public going forward of the best strategies that they can utilize. But to start off on that is the same thing that we've said from day one, the importance of hand hygiene, social distancing, and wearing masks in public. Those will continue to be part of daily life.
Thank you, Liza, and as always, thank you to you and your staff and to everyone. And also, hopefully we're going to be announcing shortly again some different testing going on in the partnership that we'll be doing with the other counties. So stay tuned for that. But also, I'd like to thank one of the best airport CEOs in the nation, Phil Calderon. They're doing a food drive with the food bank as of today. From 3 to 5, you can drop off supplies for the regional food bank in the Northeastern. We would appreciate it, and I know Phil and the team at the airport would usually appreciate it too. And I also want to thank Price Chopper for donating fruit it made to the South End Children's Cafe. Thank you as always. And our probation officers who continue to help us out delivering food and doing different things. So everyone's really been stepping up, and we're doing different jobs we usually don't do before all this happened. And I want to thank our workforce and everyone being so resilient and adapting to this new norm. So thank you, thank you, thank you. I also want to remind everyone, if you're having any anxiety and need to talk to somebody, our mental health line, as always, area code 518-269-6634. Our 24-hour sexual assault hotline number, area code 518-447-7716. And as always, our 211 with our partnership with United Way and the New York State hotline, and also just our partnership with the Capital OTB and John Signer. Thank you for being a partner, and everyone else. Thank you.